Something I could start today that would help close the gap between my worth and my value would be helping the athletes reduce their chances of having an injury. Plus, I could educate coaches and players on concussion symptoms, hydration symptoms and signs, and also educate athletes on proper hygiene to reduce the chances of skin infections and properly care for skin infections. This could help increase my value because it would help educate on concussions, which is making sure that if athletes have symptoms, what they should do about them, and hydration symptoms and signs. This way that the athletes are getting enough hydration so they will not have a chance to pass out during a practice or a game. And also for the skin infections, athletes need to know if that is something that could cause problems down the road or if it's just a rash of some sort. Also, another thing that I could change today would be life skills. The life skills would be seen differently because most athletic training students do not go up to the athletes and talk to them about it. But when you work with a specific group of athletes, you start to notice changes in specific people. So if this was to happen, then I could go and talk to the certified athletic trainer and let them know that something is going on between this athlete and that you're concerned about them, and then the certified could go and talk to the athlete about it, or even the coaches if necessary. This could help increase my value too because it could save a person's life. We don't know what would be wrong with the athlete, but if there was to be depression going on and having different thoughts, then this could possibly save their lives down the road. And then things that I could think that would help implement me as a certified athletic trainer would be injury prevention programs. I could see myself working in a clinic, and I feel like by the injury prevention programs, they could have like little things in the evening time for coaches and athletes and parents to come to and show programs such as like concussion programs that could help reduce the chances. Also show them specific bracings that may be needed, such as like mouth guards or just knee braces or any kind of bracings like that. And also training on CPR if necessary. Then that way all the coaches know that the different trainings and they can be certified in the CPR. This could increase the value because it would have a better chance of the athletes reducing their injuries, and it would help them keep them healthy on the field. By the coaches having CPR training and everything, this could help minimize the chances. If there's not enough certifieds there, then the coaches would be certified if nobody else was around. And also, another thing that they could learn would be spine boarding. So if there's not enough people during a football game, then the coaches would be able to go out there and help spine board. Also, an organization or administration duties would be helpful during a clinical setting as well, because all the athletes need to have up to date, their records need to be up to date, and with also their records being up to date, the insurance needs to be up to date. And by this all being up to date, the athlete will know how long of program or how much longer of rehab that they have to go through before their insurance does not cover it anymore. And also that if somebody else fills in for that day, then they will know exactly what the athlete is doing and what their injury is and how far along they are in the process. Each of these will help because it's helping the athlete and it's making the athlete come back to play faster. And with everything filled out, it won't have them back on a certain time, and they'll be back when they should be.